I'll have to look into that. Hello in Facebook land. We are going live this afternoon. We're talking about lower back pain. So this afternoon's session, Ask the Physio session. These are our weekly 3 p.m. on a Thursday time slot sessions where we give people the opportunity to ask questions and also provide lots of hopefully valuable information in these times where perhaps people aren't accessing their healthcare professionals, including physios, as much as they would. Hi TDC, how are you? Give me a thumbs up and make sure I know you can hear me okay. So this afternoon's session, if I just go and share my screen, let me see, could be, yep, okay, all good. This afternoon's session, let me just jump up on my screen here. Sorry, in Facebook world, you won't be able to see my my screen, but you're more than welcome to jump on. Send us an email at admin@physio-fit if you want to jump on and see the screen. We can admit you in. So again, I assume you can see my screen okay there, my title slide. So this afternoon's session
can't see it here.
Is around. Anybody else having trouble seeing my screen? We're not winning this afternoon on this. Dennis, you there? Give me a thumbs up. You can see my PowerPoint screen. Yeah. Okay. All right. Just shoot a message.
I can see it as well. I'm just not sure how to write. Sorry,
Okay. No, that's fine. Yeah, you can go to write. Yeah, somewhere there down the bottom, I think, depending on what device you're on. So this afternoon's session is about. I want to talk about lower back pain and bust a few myths on lower back pain, but we'll get to that. We'll get to that shortly. Sorry, I got what else have we got here? Oh, a couple in the chat. That's okay. No problems at all. Why are we running these sessions? Now, these sessions are aimed at keeping us connected with our client database. We've actually met a few new patients and new friends out of last week's session, which is great. And I encourage you to share these with family and friends. These are a free session. These are a 30-40 minute session on a Thursday afternoon. As I said, the aim is to keep us connected. And video, as we all know, has never been so important. Problem with my video this afternoon is you can't see me, but the connection is really important to us, and we find that people have got questions to ask, and they're probably not going to ring their local physio clinic and ask a question, but in this format we're finding that people are more likely to ask questions that they've been wanting to ask, and perhaps getting some help on issues that they have or that they know that someone has got. So video has never been more important, and this live format really allows us to interact with our database. So it's a chance for us to stay connected. As I said, a place to ask questions live, or as we've had a few emails come in today with questions via email, and that's absolutely fine. Not everyone wants to go on and ask questions live on air. So doing them ahead of time via email, absolutely fine. We respect your privacy. And we can answer these questions without anyone knowing who you are or what your situation may be. As I said, the other thing is there's always someone in a similar boat. So it's funny that when someone asks a question, all of a sudden lots of people may be thinking the same thing, but haven't had a chance to ask that question themselves. So this afternoon, I want to go through, I guess, what we're seeing in the clinic. And we did this last week. For those of you who missed last week's session, it's still up on our Facebook page if you want to go back and have a scroll through. That session was aimed around home office setup. Actually, we got some good tips and good feedback. People sending in thank yous for some good tips we gave last week around your home office setup. A lot more people working from home at the moment. And we also spoke last week about people commencing exercise and some do's and don'ts around doing new exercise based on not having availability to gyms or F45s or those types of usual trainings that people have. So today I want to talk about probably our most common condition that we see in our physio clinic. it's probably not just our physio clinic. Speaking to other friends, business owners, is similar across Australia, if not the world. And when we're talking about back pain, particularly we're talking about lower back pain today. It's a very common condition, lower back pain. Most people listening out here at the moment will have experienced some lower back pain at some stage. Hopefully that was a fleeting lower back pain, or it may have been something that lasted longer than you thought it was going to last, or for some people it may be a recurring problem that they're having. So I want to talk today around some handy tips on, hi Kate, good to see you, hi Lib, number one fans out there, thank you. So I wanted to talk today about lower back pain. So we see lower back pain a lot in the clinic. It is probably the bread and butter of a physiotherapy clinic. Lots of people come in for lower back pain, and we love treating lower back pain because there is so much that we can do to help people with lower back pain. There is so much advice and guidance that we can do to help people with lower back pain. Don't do it now, but at some stage type lower back pain into a Google search and see how many responses you get come up to that search. And if you had time to waste, you could go and read 10 of those different topics and you would find such differing advice around lower back pain. Lots of it quite unhelpful, to be brutally honest. And I will be honest today with a few of the things that we see around back pain. And there's some myths out there that, quite frankly, should have died off with the dinosaurs. So there's lots of stuff around back pain that is probably poorly understood by people. Okay, we want to delve into that a little bit more today. So lower back pain, we see lots of it, we treat it lots, and we see lots of differing presentations of lower back pain. What one person gets as lower back pain is very different to what another person gets as lower back pain. And there's a whole gamut of reasons as to why people get lower back pain. A couple of graphics up on the screen, those that can't see them. One is, central lower back pain, or pain right in the middle of the lower back is probably the most common presentation. Not the only presentation. It may be one-sided back pain. It may be pain in the buttock. It may be pain around the side of the hip. It may be pain down the back of the leg. It may be pain down the side of the leg. It may be pain in the top of the foot. It may be pain in the side of the foot. All of these presentations can have roots in lower back pain. So it will present differently. Some people will present with a sore leg, and that sore leg will actually be stemming from their lower back. So lower backs, it's the center of our center of gravity. So it is such a crucial part of our anatomy, and causes lots of problems. But for the most part, it works really, really well. Or you might be like this other guy sitting on his bed, getting out of bed in the morning, who's not springing out of bed, who's very stiff in the morning. One of the hallmarks often of back pain types, certain types of back pain, is stiffness in the morning. I treated a man this afternoon, and I know quite well. His main complaint is back pain in the morning, and it will take him an hour to get moving in the morning before he feels like his back has freed up. A very fit, active man, but with very, very stiff back in the mornings. Some people will be worse when they sit. Some people will be worse when they stand. Some walk, run, drive a car, sit at a computer, go to the gym. All of these presentations are normal for types of back pain. So I guess that's the first thing that I want to make sure that people understand. Not all back pain is created equal, and back pain is very different in presentations across the population. You go and talk to your Uncle Ron. I don't have an Uncle Ron, but if I did and I spoke to him about his back pain, it would be probably very different to my back pain, or very different to someone else's back pain. So the first mistake that I think people make is that they think all back pain is back pain, and that everyone has the same back pain, and that's not the case. So back pain is different. The other problem with back pain is that there's quite a stigma, let's face it, around back pain. And I say this all the time, and I say this particularly to younger people, in their 20s, in their 30s, who get horrendous back pain. And I'll say to them and empathise with them the fact that nobody really wants to hear about their back pain. Because if you've got a sore back, then you must be just being a bit of a whinger. And that's one of the myths, again, around back pain, is that there's this stigma around it that people who haven't experienced it won't actually understand it, because it can be very debilitating and very life-changing. So not all back pain is created equal, and there is no point, zero in fact, in comparing your back pain to someone else's back pain. It is different. 100%, they are different presentations, and they will affect people differently. So when Uncle Ron tells you that for his back pain, he took some wonderful snake oil or did XYZ exercise or stood on his head, hung upside down off his inversion table, all of that sort of stuff, thank him very much, because from the bottom of his heart, he is trying to help you. Thank you, Uncle Ron. That's excellent. Thanks for that. I really appreciate your insight into back pain, and thanks for sharing your story with me. End of conversation. He won't be able to help you too much more than that, because everyone will want to give you advice on what they did and what worked for them. Because if it worked for them, they think that it's going to work for everyone else. It doesn't. So we need to be specific when we treat back pain about what we're treating, and that will change how we're going to treat it, perhaps. Okay, the underlying principles will still remain the same, but how we're going to treat it might change. Because the other one was, let's have a look at swimming. Swimming's great for lower backs. I can introduce you to lots of people who swimming is probably the worst thing they can do for their lower back, because it's horrendously sore when they swim. So the other myth is that there's just this magical exercise that will fix everyone's lower back. Okay? So that is a myth. There is not one super exercise for every lower back. Okay? We've got to be specific. And I guess as physios, that's important. We've got to assess it, we've got to look at it, and we've got to work out, well, what is going to be best for this person. So that's the other myth, is that there's these magic exercises out there that are going to fix everything. Everyone would have heard the term core exercises, and this is, I'm going to get brutally honest here, is that term is an absolute rubbish. Okay? Absolute rubbish. Right, I can see my professor, who is one of the world-renowned experts in lower back pain from the University of Queensland, she would be most upset. So this core strength, and she was at the forefront of it, and 100% she is correct. The evidence does not lie. But the term core strength has been absolutely misrepresented hugely. Lots of people turn up and they're told, they've just got to work on their core strength. The doctor who sent them, the person said, I have no idea what core strength actually means. And I'll give you a good example. There's this famous Australian cricketer, remained nameless, got out LBW lots from Ipswich, Queensland, a blonde hair, plonked his front foot down and got hit on the pad lot. So you cricket tragics out there can text me and tell me if you know who I'm talking about. Now he was extremely strong. He had a six-pack like you wouldn't believe, yet he had chronic lower back pain. And this whole notion that if I've got a six-pack and I've done lots of abdominal exercises, therefore I do not get lower back pain, is absolute nonsense. Okay? So this whole notion of abdominal crunches equals a six-pack equals no back pain is not true. And that former cricketer isn't the only one that suffered with chronic back pain, yet was still extremely strong through his abdominals. Okay, so let's not get caught up on the fact that there's a magic exercise that's going to fix your back pain. Uncle Ron may have found the right exercise for him, which helped his back pain, or Uncle Ron got lucky and his back pain went away. But don't compare yourself with other people. Moving on to my next slide. So I want to talk about management of lower back pain and how we manage it as physios. All right. The first little graphic I've got there, and I hope everyone appreciates my graphic. That was some of the... Microsoft is a wonderful corporation that has lots of tricks and tips to make life easy for us. But so acute back pain management. How do we manage? How do we help this person that's come into our clinic in absolute distress? I guarantee you they will be distressed. No one wants back pain. No one wants to hear about them talking about their back pain. And quite frankly, they don't want to have back pain because it's stopping them from doing so much in their life that they actually want to be doing. So by the time they get to us, they're generally fairly upset. There's lots of tears in the physio clinic around this time because people are delving into why their back pain is so upsetting to them and how it's actually affecting their life. And let's face it, that's the main reason why back pain is so debilitating, because it affects so much of what we do. You're better off breaking your leg. It'll heal probably better. Don't really go and break your leg, but the rest of your body probably works okay. For a period, you can use the rest of your body. If you've had acute lower back pain, you will find that anything you try and do is often very, very painful. So the first point that I've got is talking about movement. Movement is key. Movement is key. Here comes another myth. I went to the doctor, and the doctor, who is probably 85, told me to lie on the couch for 2 weeks and just take it easy. Put my feet up and don't hurt myself. Don't move too much, just take it easy. Absolute rubbish. Movement is so important. We are designed to move. Our backs need to move like every other part of our anatomy. Okay, so movement is key. Rest is not the key. Do not rest it, but movement. So that leads me to the next one. Well, okay, movement's important. I've just hopefully stressed that, but it's the correct movement that is key. Here's another example. People sprain their ankle. Saw a good one today. Lovely black and blue ankle, nice and swollen. It's sore. So that young lady knows that she needs to get off that ankle and probably not be hopping on it to make it better, because it's acutely sore and swollen. She only heard it 2 days ago. Okay? Everyone gets that with ankle pain. Okay? But with a lower back, we can't see it. There's no bruising. There's no scars. There's no real evidence that you've done anything spectacular to your back. Okay? So people tend to want to try and just do normal things as much as you can. It'd be like the girl who's rolled her ankle playing soccer, trying to get back and go, soccer is the first thing I'm going to do to get my ankle right, because I know running on it is going to be good. Well, it will be good for it at the right time. Same with the lower back. Do too much too early, push through lots of pain, then we run into problems. Which leads me to my next point. The first key really with the lower back that is sore, very sore. There's lots of muscle spasm. We have some very strong muscles in our lower back. They are big muscles, they are strong. When they go into spasm, as in when they seize up, they become very painful. Anyone who I've treated with this, I'll talk about a cramp. Where everyone's had a cramp in your hamstring. You know how painful a cramp is? That is muscle spasm. Muscles in your back, when they spasm, will give you very, very sharp pain. Unlike a cramp, you can't just sort of stretch down, it goes away. So the first line of treatment really is reducing that muscle spasm. Right? So things like heat, and I joke all the time. I went to uni for a long time to tell someone to put a heat pack on their lower back. I tell them because it works. Heat is great at reducing that muscle spasm. Okay? There are people that will go, well, I find ice more helpful. And you know what? Good, that's fine. Put ice in it if you find that more helpful. Okay? That's fine. Generally what I'm saying is heat's going to be more effective. So heat and some gentle mobility exercises are really, really helpful. Okay, reducing that muscle spasm. So this is treating that acutely sore back. Okay, these are simple steps, but they are important steps. If we skip through them, then we're going to keep running into problems. The other thing that we've got to work out is what aggravates this person. Is it sitting, standing, walking? What aggravates them? And we can do that by looking at the way they move and getting a feel for what their back is doing. Mostly by looking at the way they move, to be honest. And certain movements will be, so are they more sore bending backwards or are they more sore bending forwards? You know, what is the most aggravating movement? And from that we can work out, well, okay, so bending forward is sore, well perhaps don't sit for too long. Let's look at standing a little bit more than sitting, or lying more than sitting, okay? Or bending backwards is sore, let's limit our walking and running, and if we're going to swim, then have a lie on your back and swim. Correct. Gold star. Well done, Mr. Cooper. Shane Watson was the cricketer. Well done. You will receive a prize later on. Very good. I knew you'd know that too, by the way. So limiting the movements that aggravate are important. Like the girl with the sprained ankle, she hops on it, she's just going to keep aggravating her ankle. Same thing with the lower back. Okay, so we've got to make sure that we know what's going to aggravate it and limit that. The next one I wanted to talk about was then getting strength. Strength and mobility are key. For those of you that listened last week, same across any injury, exercise, strength and mobility are so important. So we've got to then have an element of strengthening to it. So I think that reducing muscle spasm, heat, gentle exercises, limiting aggravation, they're all around resting. And when I say resting, resting from aggravating it, not resting doing nothing. So if we rest it, but we don't rehabilitate it. So the hard work comes in the rehabilitation, getting the exercises right, getting the strength right, okay, getting the mobility exercises right. Having a back that's strong and mobile is going to lead to us being bulletproof. I love the term bulletproof in physio because it means if someone's bulletproof, they can trust their back again. They can get back to the exercises they love and they can not have the fear of recurrence of their back pain. So bulletproof is where we want people to be. Okay? So that, in a nutshell, I guess is what we're looking at when we treat. Okay, we're looking at what movement's going to be vital. How can we reduce the muscle spasm? There's lots of techniques and hands-on physio that we do to help with that. What advice are we giving this person? What exercise are we giving this person? Okay, we keep it simple and then make sure that that person understands what we're doing. All right. The next little slide I've got here is a really interesting one. And as physios, I'll just see if I can move that. There we go. As physios, we find this really fascinating. Okay, here's some more myths for you. Right, these are a bit confronting for some people. I have a graphic in front of me based around research that's been done. So these are people without back pain, no back pain. So they've recruited people in their 30s, 50s and 80s, okay, across the lifespan. They've gone through a thorough assessment of them and a screening and asked them lots of questions, and these people have no history and no lower back symptoms at all. Okay? I need you to understand that. No lower back symptoms. They then go, okay, thanks for that. Excellent. Here's an MRI machine. We want you to get inside this MRI machine and we are going to scan your lower back. Okay? So people get in the machine, they get a thorough MRI scan done of their back and a thorough report written up by the radiologist. And here's what they found. And this study has been repeated a number of times. It is hard evidence. Okay, are you ready for it? People aged 30. Wish I was aged 30. 52% of these people with no back pain or history of back pain have disc degeneration. 40% of them have a disc bulge. 31% of them have a disc protrusion. All these horrible words that people come into us with their scans just freaking out because someone has told them they've got a disc bulge. Because here it is on my scan. And this is the information that we really love to get across to them. So half the people, over half the people have degenerative disc disease in their 30s. They have no back pain. They are fine. They are living a full functional life. Age 50, dear me, 80% disc degeneration. No back pain, no history of back pain. 60% disc bulge, 36% disc protrusion. So 80% have this degeneration in their spine. Age 80. 80-year-olds come into our physio clinic, at times are a bit horrified when they find out they've got some wear and tear or degeneration. What a lovely, horrible word that is. 96% of 80-year-olds will have some degeneration. Most people go, oh, that's cool, yeah, they're old, they can have that. 84% have a disc bulge. That's cool, they're old. But what we find most shocking, and this is really good information to give to people, because they come in and they have a scan, and their scan is already to them dictating what they think their result is going to be from their back pain. Okay? So these people are asymptomatic, but we know lots of people in the population have that. If we scanned everyone listening here, we would find these sorts of statistics. A scan does not predict wholly your result of your episode of low back pain. In fact, sometimes it's the worst thing that someone can have is a scan, because then they get frightened. And fear is a horrendous thing, because then they start to look at their report and they say, look, here are the words, disc bulge, disc degeneration. And some people are quite often, they're a little bit offended that the physio is not just dropping on the floor going, oh my God, this is horrendous. I've never seen this before. This is so bad. Mostly our response is, okay, that's good. That's really good information. Thanks for sharing that. Much like we said to Uncle Ron, that's helpful. Okay. But let's have a look at you. Let's have a look at the way you're moving. Let's have a look at a lot more than just what's on that scan. And that is so important. We're not hiding the fact. We're not belittling the fact that people have had this scan done and they've got these things on there. But that is not the mainstay of the treatment in terms of getting a scan. And it's often a question people ask, should I get a scan on my lower back? And there are only a few scenarios where we think it's valuable for them to get a scan immediately on their lower back. Only a few. Pain, that doesn't rate. We can treat that. We're not hiding the fact. We're not sticking our head in the sand. We just know that having the scan does not change the way that we would treat that. Okay? So this is super important information we feel as physios, because we need to empower people to know that they can get better. Not false hope, they can get better, and they will get better when they follow the right advice. Okay? I had a question come through. I'm going to answer that question now. This question came through on email earlier today from a woman in her mid-40s who is staring down the barrel of spinal surgery and has consulted a couple of neurosurgeons and is potentially getting spinal surgery. So that is quite confronting for this woman. So I guess where do we sit with that? Is spinal surgery the worst thing that can happen in the world, people? Well, no, it's not. Spinal surgery does exist, and it does happen. It does help people. And my comment to this woman is, what conservative management have you tried? And her list of conservative management was excellent. So she's gone through and she's done everything that through physio and strengthening work. And the question was over, well, my doctor says that planking, and as you know, planking is the best exercise I can do. I'm to avoid lots of hip flexion and rotation, because basically this woman's got lots of nerve pain down her leg, which is it's a very it complicates back pain when there's nerve pain as well. So to answer that question, I know she's listening, to answer that question, the planking is a good exercise, and hopefully I've sort of covered a little bit of that around, well, there isn't a golden exercise. I understand in your condition that bending forward and sitting, can often be painful with that condition. So planking, we're nice and flat. So planking can potentially be quite good. However, we need to make sure that the other muscles are working, our glutes and our abdominals, everything's working quite well before we start doing lots of planking. If all we're doing is planking, those other muscles aren't working, the muscles around the spine will compensate and will lead to a lot of acute muscle spasm. So planking is a tough exercise, and it's an interesting one, but it is not, I wouldn't think, the only thing that we could be doing in that situation. And I would think also that exercises around the glutes are important in that type of condition as well, but also exercises around mobility and finding the right exercises. So a down dog in yoga probably isn't the greatest exercise to be doing that can upset that sciatic nerve. But there are other cobras and some back extensions which may be quite helpful for that. And I know she's going to get in touch with me later on, and we're going to talk more specifically about that. But that's a really good example of someone, I guess, who has gone through a process with their lower back and is continuing to explore options, and that needs to be applauded. Because the biggest fear we have, I guess, as physios is that surgery becomes the first option and the only option. It should be the last option, and lots of avenues explored prior to that. We're not against surgery. We treat lots of people who have had lower back surgery, but we like to think that they have tried conservative management. If we can get it right with conservative, non-surgical management, the long-term prognosis generally will be better. But there are situations where that is the right course for a patient. It's not my job to sit here preaching about surgery versus not, because it is a fact of life, and we do see people who benefit from that. All right, so lower backs. If there's any other questions Facebook wise, just shoot them through. Let me let me know. Let me have a scroll through here. I think we've covered off on most of that. Hold on. Very good. That's fine. Just listening in, no problems at all. Good. I think we've covered most of that. I'm going to go to my. If anyone on, let me just have a look. There's something in the chat box here. I can see a PowerPoint. Excellent. Very good. Can hear. That's very good. If there's any other questions, I'm happy to take them now. If you needed to unmute yourself, generally you can do that. On your chat box, you feel free to unmute yourself. You can shoot a message through on the Zoom group chat, or you can shoot it through onto Facebook there. Or if we run out of time here, that's more than fine. I'm happy to follow up if you send an email to us. I'm happy to follow up individually if you need. Or if you need to get in contact with us, please do. We understand. We understand lower back pain is a massive issue, and as I said, we love treating it. We've got lots of good information. Physio is such a good place to be with lower back pain. It can definitely help. So as I said, any other further questions from that, feel free to send them through. Let me see if I have. Reminder also, we're running our online classes. It's been nice to see. The Easter Bunny must have been generous. There's been a few more takers in our online classes this week. So that's been fantastic. Remember, the beauty of our online classes is one, we're running a variety of classes, and I've already spoken, just earlier about the variety of exercise being very important. So there are a variety of exercise classes in there, from high intensity classes to yoga to Pilates to stretch and roll. 7 o'clock tomorrow morning, tune in. I'll be taking the stretch and roll, which is more of a recovery type class, mobility class. So make sure you bring your foam roller to that. So the stretch and roll. What else? The active lifestyle class. So there's lots of variety of classes. So we are continuing to run those classes. We are running 15 classes a week. My physio mates think I'm crazy, and how are we doing it? But I've got a great team that are delivering those classes. We've had our audio upgraded as well, which will be fantastic. So the sound quality will be a little bit better. Modern technology, gotta love it. That's our timetable. Those watching on Zoom, that will be that's next week's timetable. It's a draft at the moment. There may be a change there, but keep your eyes out on email, on our Facebook. Our timetables are out there, and also the link to explore a little bit more about the descriptions for each of our classes are out there as well. The online classes are again a good way for us to stay in contact with our clients, and we're finding that people are getting great value from that, who are really pushing their exercise and maintaining their mobility and exercise in times where they can't necessarily do their usual exercise. And we've had a few comments about, well, can't this now be our usual exercise, which is great. So people are getting great value from that. Like I said last week, Ask a Physio is here. Well, I'm running these sessions on Thursday afternoons at 3 o'clock. feel free anytime. Drop us a question. We can answer it then. We can get back to you. But these sessions we will continue to run. So if you think of any questions, write them down somewhere, and you know that this time next week you can be shooting those questions through. They definitely don't have to pertain just to what we're talking about. We'll have a different topic next week, but we're just trying to provide some general information, and then please, if you've got specifics around that, feel free to absolutely get in touch with us so we can tailor our advice specifically to individual needs. If that's all the questions for now, let me just check. Something will come through there. Then I'll stop sharing that. I'll go to my chat, and I think we're all good. That one's there. Great. Okay, I'm going to check out now. If you need some more details, please get in contact with us. Hopefully we've busted a few myths around lower back pain, and hopefully that information's been helpful. Please share this session, this information. It's a free session. Please share it with friends, family, anyone who you think will benefit. It will be on our Facebook page, but also going forward next week, opportunity to ask a new set of questions and get answers to those questions that you should have been asking. Okay, have a good afternoon. I'm signing off now. Thank you very much for tuning in.